Can I firstly say how humbled I am to be sharing a stage with so many wonderful people. A lot of the stories and information that's been shared really resonates in a way that I didn't expect it to. It should have. I should have expected it, given that I'm a 48-year-old woman who hadn't heard about perimenopause until about 2 years ago, which is quite incredible, really, and tells you something about how much we don't put emphasis on women's health and well-being as a society, really. I happen to be here by, I'm a firm believer of the universe working in mysterious ways. I did a group speaking to SENCO, so Special Educational Needs coordinators in South London. And one of those approached me afterwards and said, I'd like to introduce you to Andy and Amanda. And I met Andy from that, because of course there's a real crossover. So I think it's important to note that I am currently going through my own diagnosis for autism, and of course there's one link straight away. And what I'd ask you to think is how many of you, and please don't feel bad about this, because this isn't about making anyone feel uncomfortable, but if you've ever said something like, we're all a bit autistic, aren't we? Or we're all a little bit on the spectrum, can you hold on to that whilst I'm talking a little bit? Because maybe some of what I talk about might help you understand that that's something for those of us who are going through what it means to be neurodivergent, whether that's through formal diagnosis and it's currently accepted very much within the autistic community, particularly for women and girls, self-diagnosis. And there's a reason for that. One of them is the fact that I'm able to stand here and talk to all of you, because people have actually said to me, well, you can't be autistic. You know, why would you be autistic? You enjoy talking to large groups of people. And I actually messaged in one of my groups and on Twitter that I was really excited about being here and being able to talk to all of you. But the last thing I wanted to do was have lunch with people and some individual approach me, because I would be like, please don't talk to me right now. You know, so there are different ways it manifests in girls. And you will find that there's a significant increase in diagnoses for women as well. So just before I do go on to the general slides, I know my face is still up there at the moment. What is different about it? It takes a lot of energy to interact socially. Yes, I was a head teacher. But if you like, that's almost a stage, if you like. And because my passion is about education, whatever that means, and it's also about changing lives and making differences, well, that kind of supersedes everything else to do with any issue I might have with communication, or social communication, should I say. I have had meltdowns as an adult. If you think of a meltdown, it's the more PC way of talking about tantrums. It's not a tantrum, but mine are related to sensory things. So if someone in the audience, I'll apologise in advance, if someone in the audience starts clicking a pen, you might get a little bit of a look from me, because I actually can't help it physically. I have misophonia and noises. I have been on a train where some poor chap was doing this on a table, and my partner was sat next to me saying, stop it, because I was glaring at him. I can't do it now, but I was glaring at him, and I felt like I could kill him, because it produces extreme anger. And then he looked up and thankfully he laughed, and he said to me, I'm so sorry. And I said, no, I'm so sorry, because it's something you can't help. rationally you understand that you really can't stare daggers and look like you're going to kill someone in public, in a public sphere, but at the same time you physically can't help that. I am empathic. I have cried at some of the things that have been talked about this afternoon. You can't be empathic and be autistic, can you? Of course you can't. So there are a lot of myths around what it means to be autistic. And I say autistic rather than have autism. Now, there's a debate, and I don't want to get into it, but there's a debate within the autistic community itself. It's quite something to step your feet into the autistic community, because there are a lot of differing opinions, as there are with anything. But for me personally, autistic presupposes that it is something hardwired. To have autism is something, again, to me and many others, that suggests that it can be cured, like there's something wrong with you. The issue with that, of course, is the fact that you need a diagnosis, therefore you need the diagnostic manual, which also needs to have things that suggest it's a disorder, which, of course, it is. In that sense, I would like to think that we don't need labels, but actually in terms of being able to access support, it is something that is very, very much needed. Otherwise, without that diagnosis, often you cannot get that. And that's what kind of links to an extent to a lot of what's been said already, that at a clinical level is where we probably need the most change. Okay, on to the actual thing now. So we, within the Autistic Girls Network, but me personally, think that there needs to be a massive shift generally. I have worked for local authorities. There is, as you know, it won't be a surprise that there is a massive overspend. I can't think of any local authority that hasn't got that in relation to special educational needs. There's been a massive increase for anyone who doesn't know what it means, education, health and care plans, which are what used to be called statements. They're quite different now. And it is the parent's right to apply for those. And again, there are a number of myths around who is able to access those documents, which are legally binding for schools. I write here one LA because that's what I know already, but actually it is probably every local authority that, and I know there is, it's a picture throughout the country, and not just the country as well, where 50% approximately of new requests to assess for an education and healthcare plan are for autism. I don't know the statistics for male and female or other, so non-binary either. What I do know is that data is really very interesting, dependent on the lens that you use to view it with. So statistically, boys are more likely to have autism. There you go, I said it to be autistic. But actually, the diagnostic process is male-centric. So there are things that if you are female and autistic will not figure on that clinical profile that clinicians will look for in terms of diagnosing. How does it manifest differently? Well, the biggest difference is what I didn't realise until much later on, that I do very, very naturally, and we commonly call it masking. And it's the ability that girls have to compensate for those things that they struggle with. So in a school, you will find, I have heard principal educational psychologists say things like, she doesn't need a diagnosis, she's cognitively able and is fine socially. It kind of echoes what parents say as well, because parents talk about the fact that schools often, and this is me, hand on heart as an ex-head teacher and teacher. I'm a teacher, I'm not a head teacher, I'm a teacher by trade. And I am ashamed to say that I have probably uttered the words, "but they're fine" here in my lifetime as a teacher. That is the one thing, I think, for parents that is one of the most condescending things that you can be told by a professional. Parents are professionals in relation to their children. I say parents, I mean carers, I mean anybody who has a child. And when a school says, well, they're fine here, what that suggests is that you're lying as a parent. Or that they're fine here because we control them and everything's fine. Clearly, what's going on at home is of an issue, and it's you. You're the problem. So there's a real, if you look at the group not fine in school, I'm not affiliated with them, but I belong to them. Parents in that group have experienced, and of course young people, but the parents have experienced such trauma with social services involvement and all sorts of things, similarly to our last speaker, but of course for very different reasons. Social services involvement because they're making it up. And it's something that really does need to change. The backlog in requests for EHCPs, so that's, you know, in a educational sense, is incredible. Those teams who write those plans are completely and utterly inundated. And there needs to be a change, and there needs to be a change in the grassroots way in terms of supporting young people who have these needs. But to do that, you've got to have a shift in understanding of what it means to be autistic, because I would bet that there are, not all of you, but there are many of you who have Rain Man in your head as soon as you hear autistic. You know, you've got geek, you've got computer nerd, although I'm a bit of a gamer, but you've got that picture in your head of what it means. And that doesn't mean that that isn't the case. It doesn't mean that there aren't young people or adults who present in that way. It just means that's not the only way that it is presented. And of course, if there isn't that kind of intervention from people who know, then actually what it then leads on to are mental health problems, absence from schools because kids don't want to go in, you get fines. You know, the education system is set up, and I know what it's like from running a school, it's set up to keep kids in school, and if you're ahead and you know Ofsted are coming in and they're going to look at your attendance, and your attendance is 89% because, you know, your kids aren't always in school, even though there's a really great reason for it, you know, because of their mental health or whatever it is, because of their needs not being met, it doesn't necessarily matter to Ofsted. So you've got to weigh that up as a head, which means that you make some very difficult and sometimes wrong choices. Also, the legislation and all the diagnostic stuff is set by, so apologies for the initialisms there, so AA is actually autistic, ND neurodivergent, and NT neurotypical, so the general population. And of course, if you think in the workplace, if you're looking purely at money, for example, then actually if you don't look after those people, I mean, I'm a firm believer that if you look after your workforce in general, then you will look after whoever they look after, whether that's a client group or whether that's kids, whoever they are. To me, it's not rocket science. And if you don't understand your workforce, or those who could potentially be your workforce, so I recently heard that there was this wonderful program for autistic young people to get into the workplace, and they wanted more neurodivergence in their company. But these young people had to go and sit in an interview that's the same as any other interview, and they just couldn't do it. They couldn't sit there and do that. So where has that adjustment happened for young people, and particularly girls, I think, because for girls there is this understanding that if you look okay, you are okay. And I don't mean that that's not the case for boys, and there are boys that do have very similar manifestations of their autism as well. But in terms of a company, it affects your absence and sickness, because if you're not happy, you don't want to be there. If you feel misunderstood, The disciplinary process can be particularly painful for people who are neurodivergent. And of course, we're talking money ultimately, however you look at that. Solutions. I like solutions. I don't like just talking about problems, which is why I was very excited to be here. So what can we do? On my presentation, unfortunately, that I couldn't show as my presentation because it was PowerPoint, I'd just like to tell you that the bulb did flash on this. It was good. It was good. So in schools, consideration, teachers. I think I got 1 day's training on special educational needs as a teacher. I mean, that doesn't even touch the surface, and particularly now following COVID. And actually using people who have the experience to go into schools and workplaces. So mine is workplaces and schools, but to go into schools and really help the adults understand both about the children, but also help management understand about their workforce, because every school has got someone like me or someone slightly different, but who would identify as autistic, who perhaps isn't being used in the way they could be. Everything is stretched, so a new way of thinking about things, to be honest. I think there has to be a focus in education on teacher training and shifting that so that people understand that they're teaching everybody who's in front of them, not just those who they consider want to be taught. I really struggle with hearing that. Well, these don't want to be taught, so they can go and do that, or they can be taken out, blah, blah, blah. No, your responsibility as a teacher to teach everybody in front of you. And behaviour is communication. It's as simple as that. So what we would consider poor behaviour is communication of an unmet need, and that is for the adult to work out. That's a personal opinion, and it's a very strong one. We need to have more girls in schools who understand that actually what they're experiencing is around neurodivergence, and then they're not going mad. So I work with a couple of families whose daughters can't go to school, not won't go to school, can't physically go to school, can't physically get out of the house because they are disabled, and they're disabled by their autism, but also by the lack of understanding that professionals have of what that might mean for them as girls. So we need positive role models in a massive way, and not just in schools, everywhere. We need people to come out, as it were, as autistic. I would propose we need to have a real shift in terms of local authorities that are incredibly disparate. And what happens is local authorities blame schools, schools blame local authorities, parents think there's a conspiracy between both. And we all go around fighting each other, but actually the issue in the first place is our education system. And have a think about, what does education mean? What does quality learning mean? Well, at the moment, what it seems to mean, to me, is about being able to regurgitate facts. And that is something that made me feel like I was that person who had no possible route to learning, because I wasn't particularly academically able, certainly in school, although I went on to be, following that. So it's that quote that is attributed wrongly, I believe, to Einstein about, everyone's a genius, but if you judge a fish by its ability to climb or whatever it is, that it will feel it's stupid. And actually, it's the system. It's the system that needs looking at. Use people who are actually autistic, neurodivergent, and particularly girls and women to help train people. And this is, talking perhaps at a more clinical level. GPs, when I went to first talk about the possibility of a diagnosis for me, I was terrified. And I was terrified because I knew I'd be asked certain questions. I would be asked, why do you think you might be autistic? And, you know, I am very happy to talk to people, and I'm very confident most of the time and appear very confident. And I know that people's first impressions will be, but you're fine. Why would you need one? And it's the hidden things, it's the things I talked about to begin with that, you know, that aren't seen. I felt shame at going to the GP. Thankfully, I have a very wonderful GP who's sadly gone off sick now, but he was really understanding, and he did support me. But we know we have parents, particularly parents of girls, who are fighting a system and a battle to get that recognition because their girls seem fine. And that's not right, and that really does need to change. And I guess, you know, the last thing really is about a shift everywhere. You know, the all the materials that kind of joke or reinforce, whether that's film. I mean, there are some wonderful things out there now. Thankfully, things like Atypical, when they took on board some of the feedback from the autistic community. But there are very few actually autistic actors who play autistic roles. Do you have to? That's a debate that's out there, but there should certainly be a higher representation, to my mind. And one of the most important things that I haven't mentioned is race. And there was a study in 2018 that looked at the different ways that neurodivergence was seen, or those who were applying for an EHCP at that time, for those who are, I'm just going to say who are not white, but particularly Afro-Caribbean girls, mostly boys, and mixed heritage, where instead of getting a communication and interaction diagnosis, they got a social, emotional, mental health one because it manifested it more in their behaviour. But actually, it came from their social communication and interaction needs. You know, that was at the root of it. There's a real bias and disparity in terms of race. And I have to say, I have not got enough people who are not white in my groups, and there needs to be a far greater representation for people of colour, because it is not there at the moment, and that needs to change as well. And I don't know what it can look like, but I would like to think of some kind. Charter perhaps sounds a little bit woolly, but I think if organisations could kind of at least understand and try to make a difference and understand their neurodivergent workforce, and particularly, again, girls, then that would take us a long, long way. I'm hoping to be doing a pilot, and I'm kind of getting there with one local authority to look genuinely, and there's actually a lot of really good work with local authorities who are already doing this, where there's genuine co-production, talking to parents, young people, but this needs to be about working with the myths, and the people who really need that are the doctors, they're the clinicians, they're the people who have the tick box. Sorry, computer says, no, you don't fit into this category. The irony of how much, as an autistic person, I love categories, but it just doesn't work. You know, those of you old enough to remember the Littlewoods catalogue, that was my favourite reading as a child. There are sniggers there, I know you're all old. Who sniggered? Okay, so I'm doing that, and I'm looking for, quite shamelessly, people who are going to support that and start that both in local authority but further afield as well, and to share best practice, certainly within the education sector. Thank you, because I know as people, sometimes we can talk for England about things that we're very interested in. Please feel grateful that I haven't talked to you about Tomb Raider or any of my gaming pursuits or any of the very peculiar ways that autism manifests in me. And if anyone's interested in any kind of support, do get in touch. And thank you very much.